Queen Camilla has been forced to pull out of her royal engagement this week due to a chest infection. Dr Hilary's here. Now, the reason we're talking about this is it's so common. How many people do you know right now that have got the same bug?
Absolutely, because our immunity was quite low after COVID, all those lockdowns and social isolation. But colds and flu are back, COVID's still around, so a lot of people are complaining of chest infections. So that can comprise bronchitis, which affects the air passageways, or the lungs themselves, in which case it's pneumonia. So we're seeing quite a bit of this at the moment, often due to viruses, but sometimes bacterial infection as well. So if you've got those classic symptoms of really chesty cough with a lot of productive mucus and phlegm, if you've got wheezing, shortness of breath, discomfort, chest pain, feeling tired, high temperature, that could be pneumonia. So it's time to rest, plenty of fluids, honey and lemon drinks, maybe some cough-linctus painkillers, and just be sensible. If it's a viral infection, it's going to settle down. If you're not too bad, not too unwell, just let it pass. But if you've got a high temperature, if it's lasting more than a few days, if you feel really unwell, you're pregnant, over 65, these are the kind of people that really need to contact their GP to think about some further treatment.
Exactly. Now, look, Sir Chris Hoy, who is just the most remarkable man, he's prompted the NHS to review something that he called for in his documentary last night. Wouldn't that be the best thing?
Absolutely.
Wouldn't that be wonderful?
And you're right, he is a remarkable, inspirational man, and people follow him. And there's been a 700% increase in online searches from men asking about prostate cancer and the symptoms. So that's really good to raise the awareness. Now, what Chris is campaigning for is that men who are at higher risk, who have a family history, or who are black men, should ask their GP under the age of 50 for a PSA test, the blood test that looks for possible prostate cancer. And I think that's very reasonable, because if you've got a family history, if you have a brother or a father who had prostate cancer, your risk compared to someone who doesn't have a family history is 2.5 times higher. OK? And if you had a mother or a sister who had breast cancer or ovarian cancer, your risk is also higher, particularly if any of these relatives were under 60 when they were diagnosed. So it makes absolute sense for those people at higher risk to ask their GP about getting that PSA test done earlier than 50. From 45 onwards.
What a guy. He's absolutely remarkable. He'll be saving lives. He'll be saving lives.
He will be. He will be.
And I know that'll help him a lot.
And for men to talk about things below the waist, it's still a bit of a taboo.
I know.
And we're encouraging them, and he will do more than anybody to do that, to achieve that.
It's a fantastic documentary. It really is such a testament to him and to his wife and family. They're amazing. Hilary, thank you. Thank you very much indeed.